what does it mean to be a caregiver? What are the different things a caregiver does? You want to talk about that a little bit?
When we look at the role of a caregiver, we have to really break it down. What is a caregiver? And every stage, you may take on different roles, you may let go of some roles, or you may never let go. And so, what is a caregiver for somebody with dementia or other related Alzheimer's do? Well, they're not just there to watch the person or just there to make sure that, they went to the doctors. I think we really have to understand that people are now becoming multiple roles, like, you become the chauffeur, you become the housekeeper, you become the cook. And those may seem like, yes, of course you would do those, but you also become the nurse. You also become the doctor or provider, because you are constantly having to figure out and think, what is wrong with this person? What is going on? What does he need or she need? You have to manage the medications. You have to manage their illnesses. You have to manage the finances. You become the accountant. You become the lawyer and the advocate for this person. And then when we think about this, we put these roles all on caregivers. And many of these roles, we all went to school for years to get degrees and understanding and how to do these things. And yet we expect caregivers in that moment of diagnosis, when we let somebody know that, yes, you have this disease, and the person that's caring for them, and then we just throw all of this onto their lap and here you go. This is what you're going to do. And so I think caregivers really need to applaud themselves and give themselves a hand for all the work, that we are all doing without the resources, the education, the training that so many other people receive.
Let's go ahead and talk about one of the things that's probably the hardest is talking about managing some of the behaviors, right?
These other behaviors that nobody realizes comes with dementia. I think the most common one that people think about is the repetitive questions, which for, many people gets very frustrating. And so what I like to tell people that, we tend to classify things as, oh, that's just a dementia behavior. Oh, that's because they have Alzheimer's. And we kind of write things off professionally and family caregivers in both settings. And what I really try to get people to understand is that every single behavior, everything that is happening, there's a meaning to it. And especially in the later stages, when we're talking about when communication is decreasing, that when a behavior is happening, it's always in a response to something that happened before. So there is always something that happens, the behavior, and then the consequence. And the consequence is the reaction of the combination of the two. And I also have to get with caregivers to think about, thinking out of the box when we have these behaviors happening. But to really go before that is first to really accept and understand the disease. And if a caregiver cannot get to this point and move on, then we really can have discussions about everything else. And stop me if I'm going off in the wrong way, but really quickly, to accept it doesn't mean that when we, the providers, give the diagnosis that you just smile and you're like, okay, great, yes, we can do this. That, you really take some time for the process to accept that this is a disease at this current time that is irreversible and progressive, that we have no cure, that your responses are now to a disease, not to the person. And although we see this physical person in front of us, that it's really the dementia that is now controlling your loved one. And this acceptance process a lot of times involves grieving. You really need to grieve your current and future losses, redefine and find purpose for yourself and the person with the disease, and then really get the necessary support. And once you can do that, we can then have the discussion about behaviors, because of course, as you know, the main question everyone has is, what do I do about this? How do I fix it? And so quick to go to medications. And I am always going to do non-pharmacological things before I start prescribing medications. But real quickly, just to finish it up on behaviors, I think really understanding and taking a look and being a detective of what is happening before the behavior, like keeping a diary, which is usually what I ask my caregivers to do, and writing down what happened before that, who was around, having some understanding of the disease. For instance, sometimes they don't recognize themselves or reflection. And so at night, they may be getting agitated. Well, if you look around your house and you have big glass doors or windows, it could be simply that they are seeing a reflection and they think somebody is looking inside. And so to just close the curtain